Nephrotic syndrome is a chronic recurrent condition that presents with severe swelling, with low blood protein, elevated cholesterol, and a lot of protein in the urine. So we have several treatment options, and the accepted treatment is glucocorticosteroids. Unfortunately, these medications only treat the symptoms and do not prevent the infection and carry very high risk of side effects and complications. In the 1920s, the introduction of antibiotics allowed us to decrease morbidity related to infectious complications. In the 1930s and 40s, the introduction of glucocorticosteroids allowed patients to go into remission, but introduced new side effects and complications from the use of these medications. In the 1960s and 70s, the International Study of Kidney Disease in Children, or ISKDC, standardized diagnostic criteria and treatment options. And finally, more recently, the NEPTUNE Consortium allowed sharing of both clinical and genetic information in order to develop biomarkers in patients with nephrotic syndrome. The NEPTUNE Consortium is a collaborative effort between different research groups and universities designated specifically to collect data from patients on nephrotic syndrome with the idea and goal of developing biomarkers and personalized treatments. We could target specific diseases based on the genetic information that we obtain. We could use treatments that are targeting specifically the underlying cause, and hopefully we'll be able to not only treat the symptoms but also prevent the relapses and eradicate the disease in the future. The Nephrotic Syndrome Symposium is a platform that we started organizing here at Children's in collaboration with the Pittsburgh Center for Kidney Research. And this is a platform for education, collaboration, and information for several groups. Frequently we encounter in our practice, in nephrology practice, patients who come through offices of dermatology or allergy specialists because swelling is frequently recognized as a skin condition or allergic condition, but not so frequently as a presentation of kidney disease. So we need to educate general practitioners, we need to educate patients and families, and we need to also share information, develop biomarkers, and find personalized treatments for patients with nephrotic syndrome.